Let's talk about platelet-rich plasma as a potential treatment option for erectile dysfunction. So platelets are these tiny substances that are in the blood that are responsible for blood clots, but they also have some regenerative properties to them, and it's very easy to take a specimen of whole blood and separate out the platelets, and that's platelet-rich plasma, and that can be used for a wide variety of medical indications. Some of those indications have more evidence to support them than others. In urology, it's often used as a treatment for erectile dysfunction, despite the fact that there's very little evidence to support it. So there was a study that was published in the Journal of Urology in July of 2023, and it was done by the group at the University of Miami in Florida. So they took 61 men and they randomly assigned them into two groups. Half of the men got the platelet-rich plasma treatment and half of the men got a placebo treatment. And these treatments were injections directly into the penis, 2 injections in each group. And at 1 month follow-up, they assessed any improvement in erectile dysfunction. And the platelet-rich plasma group, about 55% of the men reported some degree of improvement in their erectile dysfunction. And in the placebo group, also about 55% reported some degree of improvement in their erectile dysfunction, which is pretty amazing. Basically, the study showed that the platelet-rich plasma had no benefit compared to placebo, but the placebo had a pretty strong benefit. And that tells us that a lot of erectile dysfunction is psychogenic, meaning controlled by your mind. Obviously, a lot of it has to do with simple blood flow and the nerves to the penis, especially in diabetic men, but a lot of it is psychological. And I think that's a lot of the reason why these clinics that offer platelet-rich plasma have had some success. Now, these clinics that offer platelet-rich plasma, they're basically cash-only businesses, because since this is not approved by the FDA or the American Urological Association, there are absolutely zero insurance plans that will cover this type of treatment for erectile dysfunction. So patients are paying out-of-pocket cash to get these treatments. And they're getting the treatments, and the patient is financially and emotionally invested in it, and a lot of them feel like they've gotten some improvement, even though they would have had the same benefit even if it were just a placebo. And then they go and they tell their friends, look, I paid this money and I got this treatment and it worked for me. And so then their friends go and try it, and their friends believe that it's going to work, and their friends invest the money in it, and so forth. It goes on, and they have this business that's basically based on a placebo, and it seems to work for them. So for us who are board certified urologists, it's very important for us to recognize this and to be able to counsel our patients appropriately, that if we don't offer placebo treatments, any treatment that we're going to offer, we have to have evidence to support its efficacy. And that evidence isn't just anecdotal, I had a friend who tried it and liked it, or I did it and it worked. When I say evidence, I mean a randomized controlled clinical trial that shows that it works better than a placebo. So definitely any treatment that you're going to get from us is going to have that type of evidence to support it. But that doesn't mean that we sort of ignore this psychological component. It's very important for us to recognize this psychological component and counsel our patients that there is a strong psychological component, and maybe with some counseling, they may be able to get some improvement in their erectile dysfunction. Now, there's no counseling that's going to have the same effect as a placebo, but it's still worth noting that there is still a strong psychological component. But for us, platelet-rich plasma is not really on the treatment options. And if you are going to go forward with platelet-rich plasma or any other sort of alternative treatment measure, it should be done in the setting of a clinical trial, where you're not just going to some halfway sketchy clinic that's going to take your cash and do this treatment. It should be done in a controlled setting, in an investigational setting, where the results of your trial, of your treatment, are going to be published in a journal, whether they're positive or negative. And that can help us move the field forward to find out if these treatments are efficacious or not.